So when patients come to our office, so sometimes they ask, can I bleach my teeth? And in most cases we say yes, but we always go through a checklist to make sure if it's going to work or if it's appropriate for that patient. And we have a checklist where we write down certain things, and one of the things is we want to check if they should have had their teeth cleaned recently, and that's one of the items we check. We check if there's calculus or tartar present, because if there is, we want to get that off before they bleach their teeth. We want to make sure there's no gum disease, periodontal disease. Some people have stains on their teeth, and some of the stains are intrinsic. In other words, it's embedded in the enamel, and those are resistant or often impervious to bleaching. And those are sometimes caused by excess fluorosis or tetracycline. Maybe as a child they had tetracycline and it caused darkness of the enamel. So those are very difficult, if not impossible, to bleach. Sometimes we'll look for enamel defects, and there'll be like white spots on the teeth or dark spots on the teeth. We also check if they have fillings on their teeth, their front teeth. If they have fillings on their front teeth and they're yellow, they're going to look more yellow after their teeth are bleached. So we'll tell the patient, you're going to need to have some of these yellow fillings replaced after the bleaching. If they have crowns on their teeth, say they have one tooth that has a crown and it looks nice, but if they bleach or over bleach, the crown won't match then their bleached teeth. If sometimes their teeth if they have sensitivity with their teeth now, sometimes we have to be careful, because sometimes bleaching gels can increase the sensitivity, and we can factor that by using a bleaching gel that has less peroxide in it, and it takes a little longer to do. Also, we check along the gum line to see if they have exposed roots or they have cavities. We check to see if they're smoking or chewing tobacco, if they have habits of coffee or tea, because that tends to stain their teeth. And we like to see how much they smile. So if sometimes people have a real broad smile like Julia Roberts, they're going to have more teeth to bleach than somebody who has just a little smile. So there's a lot to go in beforehand. And then we check the initial shade with the shade tab, and the shade tab has various shades or colors, and teeth that are gray are hard to bleach, and teeth, if a patient has kind of yellow stains, they tend to bleach well. So somebody has a gray staining of their teeth, it takes longer for them to bleach. So what we do is we hold like a couple of the shade tabs up to the patient, and we'll just take a look and see what their initial shade is, and then we record that, and then later on we check it against the initial shade tab, and then we have a baseline to see how well we're doing.